xsarah from Kalm Pilates, which is all about slow movement for a balanced body. If you suffer from back pain, actually it's a really good indication that there is an imbalance in the body. And from teaching, I know that the main causes are having a weak core that doesn't support the spine, having leg muscles that are too tight and that are pulling on the spine, and having bad posture. And actually this can be easily resolved by doing a Pilates routine regularly to sort of combat those signs and actually get more balance in the body. If your back pain is persistent and you've done my routine for 6 weeks and it's not getting better, you've got sharp pains, go to your GP and get a referral to see a physio. But in many occasions, just doing this routine will actually really help you. Before we start, we always start from a neutral position, which means that you're perfectly aligned, and we do lateral breathing. If these kind of things mean nothing to you yet, then check out our videos on that topic and then you can join us again when you're ready. Now, to start our routine, we're going to do our roll down. So I want you to have your feet hip-width apart. Find yourself in your neutral position, so you do your tilting of the pelvis, all of that, shoulders back, tummy in, head lifted and parallel. You're going to breathe at the top. Breathe out. I want you to take your chin towards your chest. Your hips stay where they are. Don't push them back because that would be cheating. We don't cheat. Right. So I want you to come down, and if you can and you have the flexibility, keep your legs nice and long. Tummy is moving into the body because you're breathing out. If you can't touch the mat, you can have slightly bent knees, otherwise straighten out. No tension in your neck. I want you to shake yes, shake no, so there's no tension there. At your lowest point, I want you to breathe in. Wide into the ribcage. When you breathe out, start lifting. Now your hips don't move, or they definitely don't move back, so keep them as stable as you can. Now you feel the weight transferring into the calf muscles, into the thighs, and then it's all abdominal work to get your spine, vertebrae on top of vertebrae, you get yourself back up. And all you're doing there is creating movement between the vertebrae, which is really helpful when you suffer from back pain. 2 more, breathing at the top. Breathe out, chin to chest. So this is all about mobilizing the spine, which when you have back pain is actually really important because often the spine is very tight. And this is something you can do even in the office, which is great. Breathe in. When you breathe out, so don't push the hips back. You feel the weight transferring from the foot, going into the calf muscle, going into the thighs, and then once your shoulders go past your hip bones, it's pure abdominal. So really pull your abdominals in to get your spine into position. Then the shoulders will drop, the head will lift, and you go back to your neutral positioning. Last one. Breathe in at the top, breathe out. This is not the most difficult exercise to do, but don't underestimate its impact, because what you're doing is you're creating mobility in the spine, which a lot of people don't have. Breathe in, breathe out. As long as you're not pushing back your hips, you're going to get a nice space between each vertebrae on the way up as well. Still breathing out, still pulling in. Lift, grow, grow, grow. Shoulders slide down, head will lift. Well done. And then we're going to come down onto the mat. So I want you to walk to the front of the mat. Come and sit down and then lie yourself flat on the mat all the way. To find your neutral positioning whilst lying down, I want you to press the backs of the shoulders actively into the mat. If you're prone to rounding, you're going to be prone to rounding in this position as well. So really open up and just keep checking with yourself during the exercise as well. Now the challenge in this exercise is definitely your spine. So when you don't support it with your abdominals, it will want to hyperextend, and that's going to pinch your lower back, and you will feel it if you don't use your muscles because it will be painful. So to make sure that you're actually engaging the right muscles, I want you to bring your belly button into the spine. So you breathe in, wide into the ribcage, breathe out, pull in your belly button, bring your right knee above the right hip bone. Not closer in than that, over the hip bone, arm length away from you. Breathe in once more. Lock the key in your abdominals to lock them down. Breathe in. When you breathe out, second knee comes up. Arm length away from you, so they're over the hip bones or further away. And this is where you're going to feel the challenge. So the challenge is your spine wants to hyperextend. You have to use your abdominals to keep it in. Wide into the ribcage, you breathe out. Pull in. So if you're not sure of if you're doing it right, take that hand, put it on your belly button and pull in. That's it. If you can, and you're a bit more advanced, take your pelvic floor all the way up when you're breathing out. Make sure that your shins are not low. You need to engage your quadriceps there to keep them up. 4 more breaths. If this is too hard for you, if you feel a sharp pain in your lower spine, I want you to drop one leg and just do this with one leg. It's not worth the injury, and you will build it up over time. So if that is you, then don't forget, of course, to swap legs as well. But of course, once you get enough strength, I want you to work at the edge of your ability so that you're actually improving quickly. Breathe in, breathe out. 4 more breaths. Here we go. 3 more breaths. Last 2. Hold on. Almost there. Last 1. Touch down one at a time. And just to relieve any pressure in your lower spine, roll from side to side. Or if you want, you can actually draw a little circle, whatever you prefer. You're just massaging your lower spine there. And then from here, you need a little bit of momentum, but you're going to roll up. If this doesn't come naturally, you can use your hands, and then you place your hands in front and come into a box position. And then you work yourself into a down position on the front. So we're doing a leg pull prone, which in normal speak is a plank, but in Pilates speak is a leg pull prone. Now when you're here, you're still in neutral, which means your abdominals are moving upwards. And because of that, you'll find that your hip bones are sinking into the mat. This is all quite subtle, but as you do this more often, you will come used to the little subtleties of this exercise. Your shoulders open up. So again, if they're coming forward, I want you to do that rotation and have them there. I'll do different levels, so if this is too hard for you, don't worry, I'll bring you onto your knees. Bring your toes under, breathe in, when you breathe out, press up. Now when you're here, if this is too hard, you can feel that you can't hold it, come onto the knees. And then come onto the elbows. And I want you to be in a Sphinx position. Now again, don't hunch, I want you to open up, do that outward rotation, and the shoulders are away from the ears. It makes your sternum slightly drop. It's very, very subtle, but very important. Now the belly button wants to hang to the floor because that's gravity working straight down. On the out breath, you pull it away. Pull it into the body rather than down. If this is too easy, come up. Press your heels back if you want a bit more support in your legs. But I don't want any hunching in the shoulders or any hunching in the hips, because in my book that's cheating. We don't want to cheat. There's no point. You're just cheating your body. So breathe in when you breathe out. Belly button in, lift the pelvic floor. That's it, 4 more breaths. Here we go. If you're shaking a little bit, it's not a problem. If you have a sharp pain in your lower spine, that's a problem. Come down, step down one into your half plank. Otherwise, you're here for the last couple. Last one. Then come onto the knees. Press back into a child pose and just relax. So this is quite a lot of work, and it's definitely quite powerful. So if you feel any sharp pains at any point, I want you to go for the easier option, or take a break when you need it and join us again when you're ready. And if it is persistent, then maybe there is an underlying reason, so you can always go and check with your GP. Right, the next bit we're going to do is actually stretch out your leg muscles, because they are connected to your lower spine and can therefore have an impact. If they're too tight, they may pull your lower spine out of alignment, and that can cause back pain. So first of all, we're going to do our glutes. So I want you to come into a box position and then slide your right knee between the hands. Go parallel with the edge of the mat there, and then sit back, bring your back leg as far as you can so that your hips are quite low, and then you have to do something quite awkward. You take your foot and you bring it into a bit of an awkward angle. You flex the foot, keep it there, bring your weight back in the middle, hip bones back to the front, and then you lengthen the spine. And then really it's up to you to how low you can go. So if you're quite flexible in your glutes, you'll find you can, with a straight spine, travel low. If it's very painful, you may be here and say, okay, this is as much as I can take, it's too painful. We're looking for discomfort, so embrace the fact that it's a bit uncomfortable. But if it's really painful, just make sure that you go to a level where you can actually bear it. The other thing I want you to do is relax. So I want you to relax the muscle. When you're stretching, you don't grip it. You just let go. Imagine it's jelly. I always find that if you if you get to know your body, you know what muscles you're working, then you can actively actually disengage them. So breathe in. When you breathe out, your glute muscles, so your bum cheek, let it go. 2 more. Relax the muscles. So if it's uncomfortable for you, then actually this is really good for you. So see this as a good thing. It means that this is actually an exercise that will really help you. And if it does nothing for you, well, you know, pat yourself on the back. You have no issues with your glutes, and that's something to be proud of as well. So that's fine. Well done. And gently bring yourself up out of this awkward position, back into hands and knees. And then with a bit of momentum, the same leg you've just brought forward, I want you to swing it between the legs, okay? Bring the back knee a little bit further back. And then straighten out the front knee. Bring up your toes. It engages your calf muscles. And then it's all about lengthening the spine and coming down. So don't just focus. A lot of people, I always notice this, they focus on bringing their nose to the knee. God knows why. But it's such a focus. No, think about lengthening the spine. Breathe in. When you breathe out, I want you to lower your tummy towards your thighs. It's a slightly different focus, but gosh, does it work? Okay, so when you're here, just breathe through it. Let go. So if you're gripping the muscle, see if you can ungrip it. Let it go. Make it jelly. Breathe in. When you breathe out, go a little bit deeper for the last few breaths. Last one. Wide into the ribcage. Pull in, that's it. Bring your knee round. That's it. Back into your hands and knees position. We're doing the other side. So slide through your left knee. Bring it to the front. Back leg works its way back. Bring that foot out in that awkward angle. And then find length in the spine. Making sure both hip bones are facing the front. Walk yourself down. Again, you stop where you feel you've got a good stretch and then relax. So if this is quite painful, this is definitely for you. So I always say to people, if you don't feel it, gosh, you know, pat yourself on the back, fantastic. You have no issues with your glutes. If you feel it, then obviously this is kind of an exercise or your stretch you want to add to your daily or weekly routine. And over time they will become more loose. It's just a muscle. It just needs a little bit of work. So let go. Breathe in. When you breathe out, let go. Let the muscle just relax. Let it sink a bit deeper. Last one. Then take your hands back into a box position with a little bit of momentum. Otherwise it's a bit hard. You swing that leg through to the front. Bring your back knee a little bit further back so it gives you a little bit more space. And then straighten the front knee. Lift your toes so that your calf muscle is engaged. And then it's about lengthening the spine. Imagine this to be a nice sort of straight line, and then make the top the same straight line. And then it's about closing the book. Breathe in. When you breathe out, close. So your tummy comes towards your thighs. Now, if you find it's quite common in my classes, some people can't actually touch the floor. They're so, I guess they're so tight that they're up here. If that is you, it's better to do it in a standing position. So just put your foot onto a table, but do the same thing. So find length in the spine, then in a standing position, and breathe out. You're coming lower. Two more breaths. Go a little bit deeper. That's it. And then see if you can get yourself out of this position in a safe way, back into hands and knees. Walk your hands towards your feet. Keep them on the floor whilst you're extending your legs. So keep them on the floor for as long as you can. And if you have no issues, they can stay on the floor. Breathe in. We're doing our roll up. So breathe out. Start stacking vertebrae by vertebrae. Lift the pelvic floor on the way up if you can. Tummy into the body. Don't push the hips back. Rise up. Every vertebrae is placed on top of the other one. Shoulders will drop, head will lift, face the front. So if you do this routine 4 to 6 weeks, maybe 3 to 4 times a week, you should see a real improvement in your core strength and your back pain. And if you like what you see, come and join our channel and actually check out our other videos, and we hope to see you there.